Hi, this is Dr. Grande. I hope you find this video useful. If that's the case, please like it and subscribe to my channel. And as always, thanks for watching. Do you have, on your presentation, do you have so many bullet points you want to cover?
Yeah, like an outline sort of thing.
Okay. Would it help to time the deep breathing with reviewing each one of those bullet points?
I've never thought about that.
I don't know how many bullet points you'd have in a presentation. Maybe you'd have 10 or 20?
Something like that, yeah.
Depending on how long
Right.
it is. So maybe you, as you start to review a certain bullet point, as you're trying to get it into your memory and think about it, you breathe in really deeply, and then as you continue on, you just let out that breath really slowly.
Like a rhythm, sort of.
Mm-hmm.
Yeah, I could.
And then you go to the next
do
bullet
that.
point and do the same thing.
Never thought about it that way.
I'm just thinking it'd be some way to structure so you would get in so many breaths, so many
So I
deep
wouldn't
breaths.
forget, yeah.
Mm-hmm. Yeah, something that kind of becomes a habit.
Okay.
Just make sure you keep your bullet points at a length that will work.
Right.
Not a few paragraphs.
Yes.
Yeah. But just a few seconds each, so you can get a good deep breath, or you could, if you did have a longer bullet point, you could have obviously several breaths, but just some rhythm that you could kind of grab onto, something concrete.
Yeah.
Because I know that in that moment things are probably, like you mentioned, zoning out, and
Right.
it becomes very easy to lose your anchors.
Yeah, exactly. I just get really foggy, almost dizzy.
Yeah, so if you can remember, for a particular bullet point that you want to take 3 deep breaths, that might be something you can really
Okay.
grab onto,
Yeah.
and would kind of cut through that fogginess, so something you could still do.
Okay.
Right. When's the next presentation in that class that's coming up?
The next one, I believe, is next Friday.
Right. Is that the next presentation you have, in all the classes? Is the one?
Yeah.
Okay. And that's next Friday.
Mm-hmm.
Do you know where you are in the order, for presenting?
I think I'm actually third in this one,
Okay,
so not first.
you're not first. And this one's how many minutes?
Like 15 or so.
Okay, it's a little shorter than the 20-minute
Yeah.
one. So 15 minutes, so you have about a half hour, maybe a little more, if there's time to switch
Yeah.
out, of kind of sitting there,
Right.
and potential time where you could be anxious.
Yes.
But also potential time when you could be reviewing
Mm-hmm.
the notes, your bullet points, and breathing.
Yeah.
And saying to yourself, that's kind of self-talk, that they're not really paying attention to me anyway,
Right.
right? Because that might help reduce that anxiety.
Yeah.
What's one thing you could say to yourself when you're up there?
I guess I could say that, in general, I do pretty well. One bad grade isn't going to doesn't mean that I don't deserve to be here.
Okay. So the self-talk up there could be, I deserve to be here.
Maybe I've prepared enough, that I know that I've prepared, and I'm a good student.
Okay. I've prepared enough. I'm a good student. I do deserve to be here.
Yeah.
All right. Is that something it would be helpful to write down and have as part of your notes, that you
Yeah, I think it would actually.
can recite that
Yeah.
internally as you...
Because it's not long, I think it would be easy to remember, and I could just maybe put it down on one of my note cards in front of me or something.
And how much do you believe that those statements are true?
I think, sitting here now, I believe them. In the moment, sometimes it's a little hard to believe because I convince myself otherwise, but I think I actually believe that's true, that I do deserve to be in the program.
Okay. So those self-talk items, you believe them to be true.
Yeah.
But you recognize in the moment, and I want you to be aware of this, you might not believe them as much.
Right.
But remember that, we worked on them,
Right.
You came up with them,
Yeah.
and you believe them now.
Right.
So try to keep that in your mind as you start to doubt yourself
Yeah.
when you get ready to recite them. Right. It's easy, I realize it's easy to form these plans,
Right.
but in the chaos of the anxiety and the worry, it's harder. So the more tasks you can make concrete and that you can write down and you can rehearse, I think the better off you'll be.
Okay.
I would like to see you, your presentation's next Friday.
Yeah.
I would like to see you right before that, so it'll be about a week
Okay.
right before that. Do you have any questions? These are items you can rehearse still, even without the presentation, the self-talk and
Right.
the breathing, and of course preparing. But do you have any questions between now and then, you think?
I don't think so. I think it makes sense.
You understand kind of the plan to
Yeah.
attack that anxiety
Right.
symptom,
And I think, what you kind of suggested before, like maybe practicing my deep breathing, like maybe now, like when I'm calm and getting into a habit of deep breathing, like I'm more apt to also remember it then.
all right. So good. So you have some kind of behavioral pieces,
Yeah.
right? The studying, the focus on studying, the breathing, and some cognitive pieces. The self-talk we talked about.
Yeah.
That you use when you're seated and that you use when you're at the podium
Right.
and actually presenting. All right, good. So I'm glad we have a plan going forward. I think that you did a really good job today helping kind of untangle all this and figure out what's going on. And I appreciate that you were able to really connect with the symptoms and the thoughts and kind of realize how they're related.
Yeah.
And I feel like this is something that's going to serve you well as you move through this.
Thank you.
All right. So I'll see you in a week.
Okay, thanks.
Thanks, Hazel.